Thank you, Madam Chairperson, Women McDonald, Santa Barbara. It's good to be here. It's good to see you. First off, let me thank you for your leadership in this issue and your voices. You've been very loud and you've been very clear. My name is Bill Gettman. I'm the CEO of Northern Rivers Family Services, and I have the unique pleasure serving two of you in your communities. Our agency serves about 18,000 adults and children every year, from Binghamton to Saranac Lake to Dutchess, and of course in the Capital Region. We employ 1,400 employees, full-time, part-time, clinical, direct care, nursing, psychoanalysts, and the like. What I'd like to do is share the view from the field right now. As our colleagues have demonstrated and the previous speakers have said, there's a critical need for workforce investments. We currently have 143 vacancies out of 1,400 positions for just our agency. We have a wait list in our 3 clinics in Schenectady, Albany, and Malta of 743 kids and adults. We only serve 2,100 clients at a time, so a third of our population can't be served. We have backlogs in residential. We have backlogs for community-based services that Ron Richter talked about earlier. And the reason is very simple. We do not have the workforce. Our workforce is turning over at the rate of about 35% per year. And the staff that come in are well-intended, but they can find opportunities in other sectors. We have done things such as increasing our wages. A year ago, I testified before the budget hearing, talked about our $12.50 an hour rate. It's now $17 an hour. It's unfunded, the increase. We increased our clinical salaries from $55,000 to $60,000 most recently for starting workers, and that has not increased the pipeline. The pipeline is dry. We have competition from the state, from the private sector, and from private practice. The answers you heard already from Glenn and Harvey and Matt about the 5.4 is critical. We need the 5.4 COLA CPI increase. Secondly, we need resolution of this licensure discussion and debate that we've had for 20 years. We need to get it resolved, and we need to increase the scope of practice. And third, Assemblymember Gunther, I want to pick up on your point. We need to make sure that the executive budget does not divert the reinvestment savings, if there is any reinvestment. Last year, they took $22 million out of it, and that was inappropriate. So very simply, we have families and kids who are not getting services in Assemblyman McDonald's district, in your district, Assemblyman. Our schools cannot, even though they want to give us room for counseling, we can't find the people to do it. We're going to lose a generation of kids if we don't invest in our workforce. So, simply said, please support 5.4. Let's resolve the licensure issue, and don't let anyone take the reinvestment money if in fact there is any. Appreciate your time and your leadership.